Meantime, I want to shift a little bit onto the front of what we're seeing on the coronavirus case count here, as it seems like things might be turning a corner in some of those worrying states. We got the update in Florida. Cases there rising by about 3.2%, pretty much in line with their 7-day average of about 3.1%, though hospitalizations in the state of Florida did notch a record up to 581. But as we said, not just Florida, we're keeping our eyes on California, also one of those states, Texas as well. Optimistically, things do seem to be turning a corner in what was a hot spot in the form of Houston and Harris County overall. And for more on what we're seeing on the ground there, I want to bring on our next guest. Dr. Hilary Fairbrother is an emergency medicine physician in Houston, Texas, and core faculty for PEDS ER. And Dr. Fairbrother, when we look at it, I mean, it does seem that way, that Houston's turning a corner, but I always like to check in with doctors like yourself who are actually practicing on the ground there. What have you seen and maybe how we should be thinking about this?
So in the last week or so, we've definitely seen a plateauing of cases, of hospitalizations in Houston, of new cases in Houston. We seem to be still seeing high numbers across the state, but Houston as a community does seem to have stabilized somewhat, and hopefully we will see consistent downturn in our number of cases and hospitalizations.
Yeah, and interestingly, we've seen kind of a shift in tone, at least in the White House there. President Trump announcing yesterday canceling the Republican convention in Florida. Obviously, as we just said, cases still running hot, hospitalizations still rising. But I mean, it seems like even in Texas, too, when we think about masks and the use there, maybe not going as far as some medical experts might want to see. But it does seem like this country has at least shifted into understanding the science backing masks as well as other social distancing measures. Have you kind of seen things maybe turn a corner since we saw that case count top 70,000 a day?
Well, I think the reality of this pandemic is really hitting my state. It's really hitting Texas pretty hard. More and more people now have a family member or someone they know who's become ill. We are just seeing a lot of new cases, a high percentage of people testing positive for this disease. And I think that influx into the community really did help people realize we have to do something or we won't have the medical resources to take care of all the people who are sick. And I think that's what it comes down to is you can have all sorts of political beliefs about the situation, but the reality is our hospital resources will be outstripped by medical need if we don't do things like hand washing, social distancing, and masking. And I think everyone is just reeling from all of the upheaval that has come with this virus. Everyone is hurting. The economy is hurting. Our children are hurting because they didn't get to be in school. It's just a terrible situation. And I think, maybe I'm too optimistic, but I think people are starting to realize that the one way that we can get through this in a long, longitudinal way that's really good for our communities is by universal masking, maintaining our distance from each other as much as we can, and hand washing. And that's what other countries have done. So hopefully we can fall in line and start to see some of our numbers move in the right direction as well.
Yeah, and we've seen their numbers move in a very different direction than what we've seen here over the last few months as you talk about universal masking and different approaches that some other countries have taken. But here, back in the U.S., as you noted, there does seem to be a political undertone that some people are worried about, particularly when it comes to the updates that we've been getting from the CDC on guidelines. They're out with some new ones after we heard the director of the CDC come out in full force saying that now's the time to really push universal masking, which would seem to be, I guess, I don't know if that triggered what the change was we saw in President Trump. But the updates on the schooling front, just want to read what they put out because it is kind of interesting to put into the context of a national story right now. But they say, quote, "The best available evidence indicates if children become infected, they are far less likely to suffer symptoms. Death rates among school-age children are much lower than among adults. At the same time, the harms attributed to closed schools on the social, emotional, and behavioral health, economic well-being, and academic achievement of children in both the short and long term are well known and significant." And Doctor, when we look at what's going on in Houston, we just got the update a few moments ago that schools in Harris County and Houston will be pushing back the opening there beyond Labor Day, something we've seen taking place in pretty much all 5 of Texas's largest counties there. So what's your take on maybe the update we're hearing from the CDC and how Americans should be thinking about the delay to opening schools in the fall?
So the CDC, the American Academy of Pediatrics, lots of people who are experts in taking care of children have been pretty consistent on their messaging that in-person schooling, almost any way possible, is the way to go. I think all bets are off when the rate of transmission, when the rate of disease in the community is really high, and that's what we're seeing in Texas right now. And that's why we're seeing those school openings being pushed back further. And I think that makes sense, because this has to be a balance. This can't just be 100% one way or another. We have to balance the welfare of our children and then also the welfare of our communities and the environment in which we are all coexisting. And I don't think anybody has any doubt in their mind that children being in school is really important for their own education, but it's also got all sorts of economic ramifications. This is important. Kids really need to be in school. And we know that children are less likely to get really sick. And we know that they are less likely to die of this disease. In fact, there's even some decent evidence that shows children under 10 don't even really get the disease with at the same frequency as older children and other patients, and they certainly don't seem to transmit it as much. Children over 10, I think the jury's still out. We've had some conflicting studies come out, but we have this information that children don't get as sick. Maybe they're not as likely as to transmit the disease. And we know that children being back in school is good for them, and it's good for the economy. It's good for their parents and families. But it has to be balanced with the rate of disease in the community. So the rate of disease in our community here in Houston is still quite high, as it is across the state of Texas. So we're seeing that schools are being delayed in their opening. I think once we can get that rate down, once we see better numbers of cases in our community going down, then we should hopefully be able to open schools.
Yeah, and that's the latest in Texas. We'll see what happens in other states here as we approach the fall reopening of schools. But appreciate you taking the time. Dr. Hilary Fairbrother, emergency medicine physician in Houston, Texas. Thanks again, and good luck out there.
Thanks.